Hi, beautiful people. How are ya? I hope you're having a great day.
With you, I can be sad with you. Just take my hand and fly up through the dreams where the skies are so clear.
For those of you who are living every day with constant pain and can't find relief, I'm wondering if ketamine treatment will potentially help you. One of my subs asked me to research it, and the same one previously asked about psychedelics, Vicky, I think. And I was like, I don't think that's a good idea. But remember, I grew up in the 70s. So that's where my brain went. LSD? Really? No. So later, she asked me to research ketamine. At the time, I didn't put two and two together because I didn't know anything about ketamine treatment. But what I learned is that ketamine and actual psychedelics work in profoundly different ways clinically, academically, bioethically, and commercially. These entities disagree on the formal definition of ketamine as a psychedelic. Psychedelics override the brain's inhibitory architecture by working on the serotonin system and 5-HT21 receptors, while ketamine relaxes those systems by working on the brain's glutamate receptors. And the end result is less pain in fibromyalgia. Ketamine does fall under a Schedule 3 drug in the United States. So it has a moderate potential for physical and psychological dependence. Other class 3 drugs are like Tylenol with codeine. It's legal as a therapy in all 50 states. There is a nasal spray that can be prescribed for depressive disorders. I put a link to the legality breakdown in several countries below. There is supporting evidence of ketamine's positive effects. So I want to share today what I've learned and tell me if this is something that you would do. I'd love to hear what you think. For me, I'm putting it on my list of potential treatments for the future. Maybe, don't know. Just in case it becomes widely available. Right now, it would be an off treatment because the FDA hasn't specifically said you can use this for fibromyalgia. The nasal spray has been approved for depression. So today, let's take a look at 3 of the ways ketamine transfusion can help. It reduces pain levels, relaxes the brain, and increases dopamine in fibromyalgia. So here we go. NMDA stands for N-methyl D-aspartate. It's a neuronal receptor in the brain and spinal cord. It can also be called NMDAR, the R4 receptor. In fibromyalgia, nociception, how we experience pain or feel pain, is considered a result of the activity of the NMDA synaptic transmissions. NMDA receptors operate channels that turn on and off, which can cause a symphony of issues. Ketamine is a drug that is an NMDA receptor antagonist. An antagonist is a drug that binds to receptor and stops or slows that receptor from producing a response because it reduces synaptic plasticity. In fibromyalgia, we know that central sensitization and disordered pain regulation at the spinal cord, and supraspinal levels, meaning above the spinal cord, which would be the brain. I don't know why they have to get so classy with the words, but that's what it means. And that has resulted in an imbalance of excitation and inhibition that has altered central nervous system, nociceptive processing, how we experience or feel pain. Ketamine has traditionally been used as an anesthetic. It can switch the excitatory neurotransmitter glutamate to off, which makes you feel drowsy. Ketamine is a glutamate receptor blocking drug and antagonist. Glutamate, a neurotransmitter, will normally switch the NMDA receptor to the on position, which causes excitatory effects on the brain and body. Abnormal levels of glutamate have been linked to depression. Glutamate helps the brain to form new connections and repair damaged ones, increasing its adaptability. But if you suffer with severe depression, there appears to be a high rate of response with ketamine in low doses. However, if you have fibromyalgia and depression, higher doses may be needed. The USDA approved nasal spray, as I said, in a formulation in 2019 because of ketamine's robust antidepressive effect. Tumor necrosis factor, alpha, has been shown to be reduced with ketamine. TNFa is a potent immunostimulator. There's been a lot of research on TNFa regarding microglia, our immune cells in the central nervous system, and fibromyalgia. It's believed that microglia in patients with fibro are hypersensitive to ATP, which may be a key factor in the complex pathology of fibromyalgia. The microglia have inflammatory functions by releasing pro-inflammatory cytokines such as TNFa and IL-1B, which is a gene. Dopamine is a neurotransmitter in our brain and also acts as a hormone. It's involved in pleasurable reward and motivation, attention, sleep and arousal, movement, behavior and cognition, and mood, among other things. It also plays a small role in our fight or flight responses. As a hormone, it reduces insulin production, slows gastrointestinal content movement, and reduces lymphocyte activity in our immune system, among other things. It's usually thought of as the feel-good hormone and what gives us that sense of pleasure. If you have the right balance, you feel happy and motivated. If you have low dopamine, you will feel tired, unmotivated, and unhappy. You might have ADHD or restless legs with low dopamine. It's hypothesized that suppression of dopamine-releasing neurons within the limbic system contributes to pain in fibro. Ketamine binds to dopamine D2 receptors and increases their release. But also, ketamine may reduce substance P receptor-mediated pain and may have an anti-inflammatory effect. Because the same neurotransmitters that control pain also regulate sleep, cognition, energy, and emotional networks in the brain. These functions, neural networks, may improve in fibromyalgia patients through ketamine treatment. So there's hope. There's been a lot of progress since the 1990s until up to today. In a review of past research, a literature review in 2021, researchers found 7 early publications from 1995 to 2011 that included 118 patients with fibro who met the inclusion criteria. But clinical studies revealed only a short-term reduction in pain, just a few hours of relief after the infusions, with a single low-dose intravenous ketamine treatment. That wasn't promising. I mean, I'm not going to sit there for 45 minutes or however long it takes just for a few hours of relief after. I don't know about you. But let's continue. These were the early days. So it was suggested by these researchers, quote, increases in the total dose of ketamine and longer, more frequent infusions may be associated with more effective pain relief and longer lasting analgesia. Beginning in 2016, researchers A.F. Hanna and A.J. Smith did the following treatment protocol on one patient with fibro, quoting the whole treatment to make sure I'm not leaving anything out. For the first day, the patient was infused over the course of 4 hours with 200 milligrams ketamine, 10 milligrams Valium, and an IV push of 8 milligrams Zofran in 100 milliliters of normal saline. Following the first infusion, the patient reported a pain score of 5 to 6 of 10. On the second day, the patient was infused over the course of 4 hours with 600 milligrams ketamine. It's quite a bump up. 6 milligrams Versed, 10 milligrams Valium, and an IV push of Zofran in 100 milliliters of normal saline. On the third day, the ketamine dosage was escalated to 800 milligrams in 100 milliliters of normal saline. No serious complications were experienced throughout the treatment protocol. Minor complications included nausea, which was controlled with a scopolamine patch, and agitation towards the end of infusion. So patients became agitated. The patient reported complete abolishment of pain following the third infusion, 0 of 10 on the scale of pain. The fourth infusion remained unchanged from the third. Following completion of the fourth infusion, the patient reported complete abolishment of pain. The fifth day of consecutive infusion utilized the same doses as days 3 and 4, 800 milligrams of ketamine. Following completion of the fifth, her pain levels remained at 0 of 10. Approximately 2 weeks following the completion of the ketamine infusion, the patient reported back to the clinic for a 2-day booster infusion regimen, 800 milligrams of ketamine in normal saline over 4 hours. Her pain levels remained 0 of 10 at this time, and the booster was well tolerated on both days of booster infusion. 5 months post-ketamine therapy, the patient reported back to the clinic for a follow-up visit. She reported active medications, including only pregabalin and a Ritalin tablet of 10 milligrams, 3 times a day. Her pain levels remained 0 of 10 at this time. I don't know what the Ritalin was for. Any of you take Ritalin? I mean, to me, Ritalin is for ADHD, and maybe she had that. I don't know. She has continued quarterly follow-up visits to the clinic, reporting pain levels of 0 of 10 at each. Her most recent visit was more than a year since her last ketamine infusion and still denies any pain, unquote. Now, I haven't had 0 pain since 2007. But this was just one patient. Can everyone with fibromyalgia get the same results? I truly doubt it. Authors of the 2018 study stated ketamine is already an FDA-approved drug with decades of safe human experience. There is considerably less risk for pharmaceutical companies willing to pursue new indications with patient-friendly routes of administration. It appears that the observed findings suggest the potential of ketamine to reduce hyperalgesia from nociception-dependent central sensitization found in fibromyalgia via the NMDA receptor blockade. So if medication isn't helping you, then this could be an alternative treatment option. I don't know how you feel about this. It's something I would definitely have to have long talks and understanding and making sure that whoever is delivering the treatment knows what they're doing. A 2021 prospective study design is expected to be completed in 2024 on ketamine treatment for fibromyalgia. I look forward to that. It's a single center, double-blind, randomized, parallel group dose escalation controlled trial. That's exciting. And I look forward to the results. In a 2022 study, a study on refractory pain that isn't responding to conventional medicine and not providing any relief, was conducted over a year in 256 patients. So they had all sorts of various things. 45% of those patients had severe pain with fibromyalgia, and 16% had mild pain. They found that higher doses of ketamine worked best on those who had mild pain or pain related to fibromyalgia, even if it was severe. They experienced more long-lasting pain relief than those without fibromyalgia. I've linked a few videos in the description section of patients' experiences with ketamine treatment. There's quite a few videos out there. These are just ones I picked. Inflammation in fibromyalgia may be why ketamine helps, because it may be playing a significant role in fibromyalgia. Because if you have small fiber neuropathy or an autoimmune condition like RA, lupus, or Sjogren's with your fibro, it may help you feel much better. There also seems to be some significance to the psychological component, or maybe the spiritual component, since patients who got the treatment stated they felt lighter, felt a stronger connection with God, that colors were more vivid, and they felt less stress and less anxiety. I mean, that all sounds good to me. So you may experience nausea, dizziness, double vision, drowsiness, or confusion during or shortly after treatment. You might feel a floaty sensation, or you may feel like you're not quite in your body. This, they say, is all normal and mildly dissociating, which is part of the process. Rest assured, they say that these feelings will pass. You might also feel anxious or agitated. So, because of these side effects, they will monitor you during the whole process. So, you're not going to be allowed to drive home yourself. So, you'll need a loved one to get you there. And then you're supposed to rest when you get home. Talk to your doctor if you have a heart condition, because you can experience increased heart rate, increased blood pressure, and increased secretions, which could lead to choking. Ketamine can interfere with medications you take, so talk to your doctor. You need to be in the best frame of mind when receiving treatment, so you should have music available with headphones handy so that you can relax and meditate prior to treatment. To find a practitioner, the American Society of Ketamine Physicians, Psychotherapists, and Practitioners, the ASKP directory, is a good place to start. One big issue for many of us may be the cost, since insurance might not cover it, and there may not be a clinic or someone who is highly qualified to do this for you in your area. If you found a clinic and have had this treatment, I'd love to hear from you. I watched a video of a lady, can't remember what country she lives in, Australia. I don't know, who goes into the hospital for a whole week, and every day for the first multiple days, she gets a treatment. I'm assuming that the amount that she gets raises each time, and she feels wonderful, apparently. But I'm going to assume that she has a different kind of insurance than we have here in the States, because that would be way too expensive. I found one down in Florida. Yeah, it's called the Ketamine Research Institute, and they have created Restore Infusion Therapy for Fibromyalgia. There may be some up here in my area, maybe in Chicago, but this is one that I found. They're claiming what they have is the gold standard for people with fibro. They do 3 days of treatment, and then monthly or quarterly appointments aren't needed. They individualize the treatments for each patient, and they say the treatment may provide relief for 3 to 6 months and potentially up to a year. So I love their website. A lot of information on that website, so I've linked it below, but they go on to say that research subjects are not the same as real world people, and people may not respond as well as those in research studies. And that's a sobering fact. And so keep that in mind if you consider this treatment. But wouldn't it be nice to be without pain for an entire year with a 3-day treatment program? Sounds good to me. I hope you learned something. I send you gentle hugs and support. Love you.
With you, I can be sad with you.
And tell me if you think there is something. It's hypothesized that suppression of dopamine increases, but also ketamine, or Sjogren's, or you might. So, because of some of these side effects, you should be monitored, and they will monitor that whatever they're called that you put in your ears.
One